there.
Hi.
Welcome. My name is Dr. Samita.
Nice to meet you.
Nice to meet you as well. How are you doing today?
I'm good.
Yeah? Okay. So I have your health form here for annual physical exam. Are there any changes to your health that I should know about?
No.
Okay. Any concerns, any questions for me before we get started?
Not really.
No? Okay, it's just your annual physical exam as always. Okay. So we're going to begin with your vitals. Have you been sick recently?
No, it's been a while actually since I've been sick.
Okay, very good. Just gonna check your temperature. You're gonna put this under your tongue just like that, and then hold on to it, please. I'm just gonna take your pulse over here. Respiration rate is 12 breaths per minute, which is on the slower end. Heart rate is 25 beats per minute. And check your temperature. 36.38, completely normal. Very good. Are you an athlete by any chance?
I used to dance.
You used to dance? Yeah, I can tell. Your respiration rate and heart rate are definitely a lot lower, which suggests that your fitness level is probably higher and your cardiovascular system is better.
Just
So, just take your blood pressure. Nice and tight. So I'm just going to have you put your hand down here. I'm just checking to see when the radial pulse is gone. Okay. Now I want you to raise your hand and pump your fist 10 times, just like that. Okay. Just gonna balance. So just relax. There you go. Okay. Blood pressure is also on the lower end, but it should be normal for you considering you're healthy and very active. That's very good. Do you ever have low blood pressure spells?
I used to. Back when I used to compulsively work out. Yeah, I would get dizzy and get really cold. It's not something I experience anymore.
Okay. And are you making sure to stay hydrated?
Yeah.
Okay, very good. That's the most important thing I find, because the more water you drink, the more fluid there is in your vessels, and the higher blood pressure can be.
Okay.
So oftentimes low blood pressure is just when you're more dehydrated than usual.
Yes.
It can also be about the salt content as well. So you want to make sure that you're eating enough electrolytes. So salts, potassium, all of those things, because they retain water, right?
Right.
And for someone with high blood pressure, I would tell them the opposite thing.
Yeah.
So be sure to drink water, but kind of reduce your sodium content and all that. Yeah. Okay. So I'm going to do a check of your skin. Have you noticed any changes to your skin at all? Any rashes or...
It's actually doing a lot better than usual.
Yeah? Okay. So let me start with a check of your scalp. What do you mean by better than usual?
Now that it's summer, my skin is more hydrated, I guess, and moisturized as compared to how it is during the winter. I tend to get eczema around my eyes during the winter.
Okay, interesting.
And like dry spots.
And what have you done for your eczema?
I usually just make sure I moisturize enough.
It's very important. Okay. I'm just checking for any lice or nits and any nevi, so any moles that are concerning. I don't see anything right now. Or any signs of eczema or seborrheic dermatitis, anything like that, which I don't see. Okay, very good. All right, now I'm going to do a check of your skin as well. Okay. Okay, just look up. Just gonna take a look at your neck area. Good. And you haven't noticed anything around here? No. Okay. I'm gonna check your arms. Do you ever get eczema on your arms? Like around here? Okay. So that's usually where we see it, eczema on the flexor side, and we see psoriasis on the extensor side, but you seem to be all clear, which is very good. You seem well hydrated as well. And the temperature is also great. I'm just going to check your nails and see if capillary refill is... We want it to be about 1 to 2 seconds. Anything longer can be circulation issues. Very good. Just going to raise this slightly and take a look at your knees. And again, I don't see any signs of psoriasis. Good. Okay. Are these all mosquito bites?
They're flea bites, actually.
Flea bites, okay.
I got a flea infestation in my room when I lived in India.
It's unfortunate.
Yeah.
It'll hopefully heal.
I hope so.
Just leaving
They're not very attractive.
It's all good. Okay, and this, was that a burn?
That was a scab.
Okay.
Yeah.
And just check your capillary refill again. Very good. It's a little cold down here.
Yes, I tend to have cold feet and hands.
Okay, your hands are fine, but your feet are.
Yeah, the room is warm, so my hands are good for now. But yeah, usually my hands and feet tend to be cold.
Okay, we'll definitely write that down because that could be a bit of a thyroid issue. Right, or it could just be normal for you as well. Okay, just making a few notes here. So 3 bites. The leg. Okay. We can always run some labs for you as well and check your thyroid function. Yeah, let's do that. We'll run that lab test. Okay. Now I'm going to check your eyes. So I just want you to look straight ahead right there. Just looking for anything on the cornea or iris, any shadows, which I don't see. Okay, good. Okay. And then just grab another pair of gloves. I'm going to do some palpation. Okay. So you can close your eyes actually. Just looking at the lacrimal apparatus. If there's any swelling. Have you noticed any issues with like tearing or anything like that?
No.
Okay, that's very good. Okay, you can open up again. To see if eyebrows are full. Okay. Can you look up for me? I'm just gonna look at your conjunctiva. Okay, very healthy. And then just look down. Look. Okay, good. I'm gonna check your pupillary reaction. Look straight ahead again. Very good. Okay, other side. Okay, very good. All right, anything else with the eyes? I'll do the ophthalmoscopy in a second. Let me palpate your sinuses. Any pain or tenderness here? No. Any pain or tenderness?
No.
Palpate that one. Paranasal. Let me know if there's any pain or tenderness. Good? Okay. I'm going to test you with a Snellen chart. All right. Do you know what your vision is? You don't wear glasses or contacts.
I don't.
Okay.
I think it's 20/20.
Okay. So I want you to cover one eye, whichever one. Okay. And 1 second. I want you to read the lowest line for me. That way.
Okay. 428,739.
And an arrow, like a point. Which direction?
Right, up, down. OOX.
Okay, very good. Other eye. I want you to read the same line but backwards, okay?
Backwards. XOO. Down, up, right. 937,824. This one's a little more difficult.
Okay. Well, I would say 20/20 for both eyes. I just noticed that sometimes you would come closer and it's a bit of cheating. It's okay. Alright. So for this one, what we're gonna do is we're gonna cover this eye, the one that's right across, yep. And you're gonna look directly at this eye. And then when you see my fingers wiggling, you're going to just let me know that you see it, okay?
Okay. I see it.
Okay.
I see it. I see it.
Okay. Actually, same eye. I'm just gonna switch hands.
I see it.
Okay.
I see it. I see it.
Very good. Okay. Now we're gonna switch eyes. And look at my eye. Okay, so I'm gonna. There we go.
Yeah.
Okay. Good. Okay, very good. So, peripheral. Well, it seems like your peripheral visual fields are intact. So it's very good. I'm gonna turn off the light. We're going to do ophthalmoscopy, okay? I want you to look straight ahead and let me know if you feel any discomfort, and I can stop anytime, okay? Just looking for that red light reflex. Coming in. Okay. Very good. Other side. How's your eye feeling? It's okay. Just this side. Okay, there we go. Yeah, I know it's a little irritating. I'm sorry. Perfect. Beautiful. Yeah, your optic disc can cut great. The ratio's good. Don't see any issues. Might as well check your sinuses as well. See, Good. This one is a little difficult to see, but I do see it. Okay, your sinuses are clear. Ediya, next we're going to check your ears. So I'll start on this side. Any pain? No. Any pain?
No.
Oh, sweet process looks good. Okay. Start off one of these. Let me know if you feel any pain or discomfort. Beautiful. Nice cone of light. Bony landmarks are present. Signs of erythema. Wonderful. Have you had any issues with this ear before?
Yeah, I had 2 surgeries on it.
Okay.
Yeah.
There is a tiny white piece at the top.
Yeah, that's probably the piece they added.
Okay.
Because I was missing something in my middle ear.
Mm-hmm.
That's what they told me. Yeah.
Interesting. I'll have to check your file for that. But there doesn't seem to be any signs of infection. Your tympanic membrane looks beautiful, so very good. Let's take a look in here. Okay. See a little bit of earwax in there, but the tympanic membrane also looks beautiful. Cone of light present, landmarks present. No erythema, no bulging. Wonderful. Any issues with this ear?
No.
Okay, great. Yeah, that was probably the most, the cleanest ears I've ever seen, to be honest.
Really?
Yeah, they're very nice. Okay. Now you said you had some issues with this ear. Can you tell me more about it?
I think my hearing on this side is around 50%, 50
Okay.
to 60.
Okay.
And that's after the surgery. So,
Okay, I see. In that case, I'm not going to do a hearing test on you because do you already get it checked with an audiologist?
Yeah.
Okay. We'll just skip that part. I'm sure they're a lot more experienced than I am about those things. Okay. Let's take a quick look into your nose. So I just... Any issues with your nose recently?
No.
It looks good. No signs of discharge or redness. Very good. Okay. Now I'm going to take a look in your mouth. Yeah, I'll just do it like this. Open up, say ah.
Ah.
Okay. I don't see... Tonsils are not enlarged for sure. Take a look at your teeth. Huh? When's the last time you got a dental checkup?
Maybe half a year ago.
Okay, good. You've had braces before as well?
Yes.
Say ah again. Your pharynx looks good too. No redness, no exudate. I don't see any cobblestone effect either, so you probably don't have very much post-nasal drip. Okay. Yeah, any concerns with your throat?
No.
Okay, good. Okay. Alright, Ediya, so now I'm going to check your lymph nodes. So I'll start with your preauricular lymph nodes. Push this back. You haven't had any ear problems, so don't suspect anything, no. Let me know if you feel any pain or tenderness. Cervical. Is there any tenderness here when I Just checking because that's where your larynx is. Okay, I'm just going to move your head slightly like that. Good. Going a little bit deeper. No, nothing there. And you said you haven't been sick recently. Okay, I want you to shrug your shoulders. Okay, let it down. Okay, good. You can also check the ones in here as well. Just check your lymph nodes. The ones in the back. Central. Check up this side. Alright, good. And then I'm just going to check your thyroid. So I'm just going to move your head like this. Yep. Sorry. Okay, other way. Just relax like that, yeah. Yeah, I don't feel any nodularity or any enlargement. Good. Have you ever had any pain in that area?
No.
Okay. Okay. Now we're going to do the respiratory portion of the exam. And I'm going to be auscultating your lungs, okay? So whenever my diaphragm, my stethoscope touches your skin, like, sorry, it's a little cold, like this, I want you to just take a breath in and out, okay?
Okay.
Thank you. Start up here. Go ahead. Give yourself a big hug. There you go. Breath in and out. Good. Breath in and out. Very good. Good. Okay. Let's take a little break. Come on to your other side. Okay. I'm going to percuss, okay? Same areas. Continue to give yourself a hug.
Okay.
Thank you. I'm also going to do something called whispered pectoraliloquy. So you're just going to whisper 1, 2, 3, 1, 2, 3, okay? So just keep, every time my stethoscope touches you, just go ahead and do that.
Okay.
And again, give yourself a hug.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. And again.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Very good. All right. Next, we're going to do something called diaphragmatic expansion. We can release. Just going to find, rotate an area. Take a deep breath in and out. Very good. Very symmetrical. Okay, Ediya, so now we're going to do a little bit more auscultation percussion on your anterior chest. So same thing as before, I want you to just breathe in and out for me.
Okay.
Okay, other side. Good. Let's percuss. And next we're going to actually auscultate your heartbeat, okay? Start with the diaphragm. At this time you don't have to do anything. You just close your eyes and relax.
Okay.
Just going to move this up slightly. Looking for any signs of murmurs. Sounds very good. Okay. Just going to listen to your carotid artery. Okay, no signs of bruit. Very good. Just gonna check your trachea as well, making sure that's in line. Okay. Next, I'm going to do your abdomen exam.
Okay.
I'm just gonna raise this slightly and just reveal a little bit down here. Is that okay for you? To start again with auscultating. Again, you don't have to do anything this time.
Okay.
Listening to the frequency and intensity of bowel sounds. Okay. A little more active on this side. Are you okay?
I almost fell asleep.
Sorry?
I almost fell asleep.
Alright. I know, it can be really relaxing. Okay. Bell sounds aren't that frequent, so that's good. Nothing too loud either. Just do some percussion. Seeing if there's any areas of dullness. A bit dull there. Have you had any abdominal pain recently?
Not recently.
In the past?
As a kid, I used to struggle with stomach aches and digestion.
I see. And it's resolved now?
Yeah.
Very good. I don't hear any areas a little bit dull there, but that could just be stool. Okay, very good. Now I'm going to do a superficial palpation and then deeper. So you're going to let me know if there's any pain or tenderness.
Okay.
I want you to put up your knees. Yes. There you go. Any pain?
No.
Okay. You're not ticklish, are you? That's good. Then a lot of my patients start guarding at this point. Like they start like tensing up and
It's not the most pleasant sensation, but yeah, I can bear with it.
yeah. I'm gonna go a bit deeper, so this might be uncomfortable. Just try to relax as much as you can. Again, looking for any masses that I should be concerned with, but so far nothing. Or any enlargements of organs, just the spleen or the liver. So I think there's a little bit of stool right there. Okay. All right, we've come to the end of your exam, or close to end. So I'm going to do some neurological testing for you, okay? So first I'm going to test your muscle strength. So I want you to always resist into my hands.
Okay.
Resist. Very good. Bring your arms out like this. Resist. Resist. Okay. This way. So bring your arms like that. Resist. Good. Very good strength. Keep it like this. Resist. I want you to grip my hands. Very good. Okay. Resist into my hands. Very good. 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 Now right here. So bring your. Let's do it this way. Resist. Resist. And this. Good. And here. Very good. Okay. Now let me check your reflexes. Triceps tendon. Good. Relax as much as you can. Good. Good. Okay, just going to do these ones here. Actually, I forgot the wrist ones. Just like this. Relax. Just going to have you relax. Can you count 1 to 10?
Yeah. 1, 2, 3, 4, 5, 6, 7.
Just a little bit of a reaction here. Okay, again, can you count for me?
1, 2, 3, 4, 5,
Just a bit of reaction. Okay, and then I'm going to do your ankles here. So relax. Okay. Good. Okay. Last but not least, we're going to do some coordination tests. I want you to just do alternating hand movements like this. Faster. Faster. Okay. Very, very good. Next, I want you to use your index finger and touch my index finger and go back to your nose. Back. Faster. Okay. Yep. Very good. And a little quiz at the end. What is your name?
Ediya.
Okay. What day is it today?
July 1st.
Yes. Where are you?
Canada.
Where are you right now?
I'm at the doctor's office.
Okay, perfect. Okay, Ediya, so most of your exam findings have been negative. There's a few things that I want to check. We're going to run some lab tests for some thyroid work and then the regular CBC, a urinalysis, all of that stuff you're familiar with. Okay. Do you have any questions for me before we go ahead with those?
No.
Okay. So I'll have my receptionist give you the lab test requisition. You get that done, and then in a few weeks we'll meet again, okay?
Okay.
All right.
Thank you so
Take care.
much.
Thank you.
Thank you.